All right. Okay. Thank you, everyone, for joining in. My name is Nick Stoick, and I'm going to be running through and answering the question, what is PCS Spark? So, in a nutshell, PCS Spark is a digital patient simulation that is able to communicate with the power of artificial intelligence and machine learning. So students are able to speak naturally to these virtual patients, forming their own questions rather than choosing from a drop-down menu. So let's go ahead and get started right away. So looking at my screen here, this is the simulator list. So once a student logs in, this is something similar to what they would see here. I'm going to be working from the Spark demo simulator. I'm just going to click start here, and we'll see a list of patient cases that have been assigned to me. So in today's demonstration, I'm going to go through the Valerie Miller case, which is one of the 3 free patient cases that we provide to everyone. And then once I click on that, we'll get a little background information. She's a 38-year-old female who's come into the clinic today with complaints of a headache. So once I click on start here, that's going to begin the scene. And immediately we're brought to, just a brief tutorial instruction on how to begin the simulation. So obviously we speak with our patient by using the little microphone button here or the speech bubble here. We can conduct a physical exam by clicking on the shirt button. And then once we're done with the simulation, all we need to do is click on the stop button. And that will end our simulation, and we will get immediate feedback on how we performed. So I'll click OK, got it there, and then immediately we're just brought to our patient sitting in front of us. And this is our redesigned user interface. So now we have the patient really front and center, taking up the full screen for a much more enriching experience for students. And I'm just going to go ahead and start communicating with our patient here to kind of see what's been going on with her. So, hello.
Yes, hello. How are you?
I'm good. How are you?
I could be better, thank you.
I'm sorry to hear that.
That means a lot, thank you.
And what is your name?
My name is Valerie Miller.
Okay, Valerie. And can you confirm your date of birth for me?
11th of April, 1983.
Perfect. And what brings you in today, Valerie?
I've been having these horrible headaches for the last few weeks.
Okay, and could you describe what the headaches feel like for me?
They feel sharp and at the same time, they're pounding.
All right. And if you had to rate the pain on a scale of 1 to 10, what would you rate it?
It's pretty intense. If I had to rate it on a scale, it's probably an 8 out of 10.
Okay. And have you noticed any blurriness in your vision?
Maybe some blurriness during a headache, yes.
Okay. And have you vomited at all?
In the past 2 weeks, yes. I vomited twice when the headaches first started, but not today or in the last week.
Okay. Is there anything that makes the headaches better?
Rest and time. I'll try to find a quiet, dark room and lie down until the headache goes away.
Okay. And is there anything that makes the headaches worse?
Everything I do seems to aggravate me when I have a headache.
Okay. Have you tried taking any medication for these headaches?
I've been taking extra strength Tylenol, but it's not helping.
How much Tylenol are you taking?
I usually take 2 Tylenols, but when the headache is really bad, I take 3 to 4 caplets. I think they are 500 milligrams each.
Okay. And have you ever had headaches like this in the past?
I'd get headaches when I was a teenager, but I don't remember them ever being this bad or this often.
Okay. And do you ever have a family history of headaches like this?
Yes, actually, my mom had migraines. I remember as a kid seeing her have these debilitating headaches.
All right, so I'm just going to pause the conversation there. But that kind of really gives a good overview for everyone on what these conversations look like with our Spark digital patients. And I always like to touch on, a few different points that we saw there. The first of which is that essentially nothing that you saw there was scripted. So a student is able to ask these questions in any particular order that they deem most appropriate. And there's no specific way that a student needs to, ask a question. Thanks to our AI conversational engine, the software is able to understand over 40,000 different variations of questions. And in the event that a student asks a question that the AI isn't able to understand, at that point, that's kind of where the machine learning comes in and is able to, make an educated guess on, what the correct response would be. If it's not confident enough in the response, it's at that point that the AI will say, I'm sorry, I just don't understand. Could you rephrase your question, or something along those lines, which is, not too unrealistic compared to, what a physician would see in the actual clinic when a patient might not understand specific phrasing or jargon that they might use. But also, it's important to keep in mind some limitations that the AI may have. And they're not major ones, but it's important to remember the first of which is contextual understanding. So that's one of the big challenges that some of the big AI players such as Google and Microsoft have with their conversational bots, and that is the contextual understanding, or what was being referenced in the conversation. So the AI isn't necessarily going to remember exactly what was said in a previous question. So for example, if you're asking the AI, have you taken any medication, and they respond yes, and then you follow up with how much, it's at that point then the AI might not know that you're still referencing the Tylenol. It might think that you're asking about how much alcohol they drink on a daily basis. So that's one of the things that we're still working on and getting better at on a daily basis, but it is still one of the limitations of the conversational engine. And then the other one too is just in regards to stacked questions. So with stacked questions, if you were to ask the patient, have you had any blurriness in your vision, or have you vomited at all? The AI will pick one of the two to respond to, but it's not going to be able to respond to both. But again, in most instances, students aren't going to be taught or trained to ask stacked questions. So again, not really too much of an issue. But all of our patients, they are able to, answer questions related to history of present illness, past medical history, social history, so you can ask them about their family, what they like to do for fun, and that sort of thing, and then also risk factors as well. So, if they drink, they smoke, they wear their seatbelt, those types of questions, all of which are built into the knowledge base of these patients. So once a student has, kind of wrapped up their interview with the patient, they can move on to the physical assessment portion. And that's done just by clicking on on this little button down here in the bottom left, and that will trigger the physical exam. And now we're kind of zoomed in on the patient's face. Now what's nice here is we can pan around to the different parts of the body if we're interested in looking in different areas. Or we can also zoom out to get kind of, more of a holistic view of the patient in front of us. I'm going to zoom back in though and highlight some of these options up here that we have in the top right hand corner. The first of which is going to be this little eyeball icon here. So the eyeball icon is going to be for getting a closer look at the eyes, the ears, the nose, the mouth, those sorts of things. And all that's done is by hovering over the specific body part that a student wants to look at. So for example, if I wanted to take a closer look at the eye, I can click down and then I immediately get both a text interpretation as well as a visual look at the vasculature of the eye and then just kind of a close-up view of the eye. And this format is really nice because if you're going in and creating your own custom content, you're able to upload specific images for these health assessment findings. So if you wanted to have, for example, a patient with pink eye, you could upload images of an actual person with pink eye so that when a student looks at the eye, they're going to see that in their health assessment findings. So again, you can do that for the eyes, the ears, the nose, the mouth, the throat, the skin, pretty much anything that has a visual indication that something might be wrong. One other really cool thing that is neat is if you're doing this in the virtual reality version of Spark, you would actually see a tray of tools lined up in front of you, and depending on the body part that you want to look at, you would pick up the correct tool specific to the action that you're going to perform. We also have here on the right hand side this stethoscope. So this is going to be for auscultation. So now if you click that, then as you mouse over the chest, you're going to see the stethoscope show up. And then depending on where you click down, you will hear the specific sound that you're hovered over. So you can listen to heart sounds, lung sounds, bowel sounds, and then again, we have a library of sounds to choose from, so you're able to get your students exposure to more than just a healthy and normal pathology. And then finally down here on the third button is the physical examination tool. So for example, if you wanted to perform a abdominal exam, you could click on that button, and then if you press down on the different quadrants of the abdomen, you can get feedback on if there is any abnormal findings there in helping with the student's differential diagnosis. So that is the health assessment piece there. Once a student is done, they can simply click on the leaving the physical exam, and then the patient will be back with their clothes on and sitting in the chair. A few other quick things before we wrap up here. We also have a vital sign monitor. Now, typically, in the clinic, there won't be a vital sign monitor, so you can, of course, choose to hide some of this information from a student. But the reason that I wanted to bring this up is that we also have a full model-driven physiology. So if you wanted to give your students exposure to, what certain drug interactions might look like or effects they'll have on the physiology of the patient, they can do that with the model-driven physiology. So you can see we have a list here of different drugs to administer. For example, if I were to choose epinephrine and then the delivery method here, I can change that and then choose how much dosage I want to give. And then once I click on administer, we'll see here the heart rate spikes up, the blood pressure spikes up, and all of this is taking into account the patient's age, the patient's weight, and then of course any pre-existing conditions that the patient might have, for example, like high blood pressure or what have you. So that is the vital signs section there and the model-driven physiology. And then this other button here that you might have noticed, this is TeamSpace. And TeamSpace is for multiplayer simulations. So up to 8 different students can connect to a single Spark session and work through a patient case together. And they can communicate in this window here, either over chat, like text chat, or voice chat as well. So they can be using their own voice, and then when a student speaks to the patient, everyone in the simulation session is going to hear that. Similar if someone is doing a health assessment, everyone is going to see the results of that. Plus, down here in the sim log, so all of the interactions are going to be captured here in the sim log. So everything that the students say is going to be captured with this little stethoscope icon, and everything that the patient responds with is going to be this little patient avatar icon here. So the whole conversation is going to be transcribed, and then also all of the actions that are performed, those are going to show up in the log as well. Now, what's neat too is if you're having a TeamSpace session, there's multiple students connected, then you're going to get some learner attribution as well. So if one student is asking all the questions, it's going to show up in the log of who is asking what and who is doing what. So that is the sim log there. So once we click the stop button, that's going to end the simulation. Now, in certain circumstances, you may have an end of sim exercise option enabled. At that point, there will be a list of questions that are presented to the student to answer. In this case, there is not an end of sim exercise. It's just the immediate feedback that is provided to the students. And you can see in this case, I scored overall a 39%. And students have the option, of course, to get a breakdown of what areas they received credit for, and then also what areas still need work. So that was just a really quick overview of PCS Spark. Thanks for joining us on this quick IMSH live stream. Sorry we couldn't make it to the conference this year, but we hope to see you again in 2023. All right, thanks so much.